The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. My name is Mary Howard. I am one of the business analysts for the WebBGAS system, and I want to welcome you to the webinar for the 2020 PAMI report. Just to let you know, you're all muted. So if you have any questions, please enter them in the chat. We will be taking breaks throughout the webinar to respond to the questions. We will also gather all the questions and responses together and complete them as soon as we can and send them out in an email to all of you who have attended. At this point, I would like to introduce Lisa Stallworth. She is the PAMI Program Coordinator. Lisa?
Good morning, everyone. I am Lisa Stallworth, the PAMI Program Coordinator. Thank you for joining today's webinar to review the new revised PAMI Program Performance Report, PPR, which includes the Advisory Council Report, ACR, for the fiscal year 2020. The new revised PPR and ACR was opened in WebBGAS on October the 19th, 2020, and is due by 11:59 p.m. Eastern Daylight Time on January the 1st, 2021, based on the PAMI program statutory requirements. The purpose of today's webinar is to navigate through the PPR and ACR and point out the significant changes that were made to improve the efficiency of data entry. When the opportunity is given, please feel free to ask questions. You may also contact your assigned PAMI program officer by email or phone with any questions you may have while completing the PPR and ACR. SAMHSA would like to thank the PNAs for the services provided to individuals with mental illness under the PAMI program during FY 2020, despite the many challenges that resulted from COVID-19. Now, I would like to turn the session back over to Mary. Thank you all so much again.
Thank you, Lisa. To begin with, we're going to just brief summary. We're going to review how to enter the information into WebBGAS and how to navigate the WebBGAS system itself. So to begin with, the logging in process. Just to let you know, we are going to be using the test site where we go in and test to make sure everything is correct. When you log in, you will be going to bgas.samhsa.gov. That's bgas.samhsa.gov. And that is the production website where you will be entering your data. When you first bring the screen up, you'll see that there is some information here if you need so. For instance, if you've forgotten your password, you can simply click on this link. It will take you to another site where you can request to update your password information. Same for if you forgot your username or if you need a new user account. The one thing we do ask is that you do not pass an account from one person to another. That is federally illegal. So if you need a new account, please just click on this link right here and it will walk you through the process. Also, you'll see here there's a box that says if you need assistance. At any time, you can simply click on the help desk page email that will help, or you can give our help desk a call, a great staff at our help desk a call at 1-888-301-2427. That's 1-888-301-BGAS. All right, now to log in, I'm going to go ahead and log in. And when you initially log in, you will get this window shade, and if there's any important information, it will let you know. Okay. Let's try this again. Here we go. I apologize for the error. Once again, the window shade does appear, and there's the updated information for your review. And then you're taken to the Welcome to WebBGAS screen. Now, one thing I need to point out is only a state supervisor can create a new grant application. When you log in, if this link right here does not appear and you're supposed to have that permission, please contact your SAMHSA PAMI project officer, and they will notify the help desk, and the help desk will assign that permission to you. So that's the first thing I wanted to point out. You must be a state supervisor to open an application. Once it's open, everyone will have the view an existing application link. Here at the top, you'll notice we have a menu tree or a menu bar. There are a couple things I did want to point out. For one, if you go to support and come down to the menu tree here on the left-hand side and click on training, we have located here all of the manuals for the different applications within WebBGAS. And if you come down, the second from the bottom is the PAMI application tutorials. The first one is for the application, and the second link here is for the performance report, the PPR. So you can go ahead and come here and download this and keep it on your desktop for reference if needed. The other thing I wanted to point out was the state Pna profile. I just want to point out that if you go in and complete this or make sure it's updated before you open the application itself, any of the updated information will automatically pre-fill to the required screens. All you have to do is simply come to one of the edit buttons, update the information, and click on save. And like I said, and we'll go into that in just a minute, a little further information. All right. Now, another thing I did want to point out was, you'll see here it says existing applications. So you can click here and it will take you to the applications that are already open that you can go in and view. The other thing I did want to point out is if you ever get someplace and you're not sure what's going on, if you simply click on this icon, the WebBGAS icon, it will bring you right back to the welcome screen and you can go from here. So you have the option. You can view an existing application from here, or you can do it from the menu tree at the top. You'll also find here that if you want to run a report or have a report request, you can click on this link. If you want to change your password, you can do so from here. Or if you want to contact the help desk, you click here, it will take you to a screen where you can basically put in your information and what assistance you need. And this will be sent to the help desk automatically. Now, I've already created the application. So I'm going to simply click on View an Existing Application. and it takes me to the list of applications that are open that I can have access to. And you'll see here, it says number of revisions, what the status is. You'll see this one is in progress, the top one, the 2020. The others have been submitted and some have been approved. What the progress is on them, the date they started, the date entry ended, when it was updated last by a user. And the one thing I did want to point out here was you'll see, if you wish, you can make a hard copy by clicking on print here of the entire application. So if that's what you need, instead of doing each individual page, which I'll show you here in a minute, if you come here, you can go ahead and make a hard copy of the entire thing. All right, I'm going to come over and I want the 2020 PAIMI Progress Report. When you click on that, it brings you to basically an overview. This is your introduction screen. You'll see here, it has recent activity. It'll show you what has last been updated, when it was updated, and by who. The important things I wanted to point out for this screen is under related documents. You'll see we have the Advisory Council Report, the ACR, and we have it in Word and PDF format, so you can reach that from here. And we have the Annual Progress Performance Report, PPR, guidance and instructions. So if you want a full copy of the instructions, you can also get those from here, also in Word or PDF, and save those to your desktop. Let's go on, and we're going to go ahead and go into the PPR itself. And to do so, you just simply click on View Application. And here we have the 2020 PAIMI PPR. Before we go any further, Crystal, are there any questions?
No, there are not.
Okay, thank you. So, but basically what we're going to do is, there have been several changes to the verbiage and the questions themselves. And I'm not going to go into great specific detail of every question that's been changed. I'm going to do a basic overview. If you have any questions regarding a screen, please go ahead and enter that and we'll go back and review. You'll see here we have the left menu tree, and here we have what we call the overview screen, and every report you can see right here on the overview screen. And we're going to go into detail of what these bars of percentage and in progress mean. So you can get to all of the reports from here. I'm going to click on General Information. This is the first report or table within the report. And you'll see here, there have been no major changes to the General Information screen. The only thing that was changed was we replaced satellite with other office. So where it used to say satellite, it now says other. Also, to let you know, you can see here, you can add multiple satellite offices, and I've done so here. And that's why this X is here. If I was done an error, if I want to remove it, I am more than welcome to. Or if I want to add another one, I simply click on the Add Office, and it will once again open another block where I can add. So you can add multiple satellite offices. Now, once again, the other thing I want to point out was, remember I told you if you went to the state Pna Profile and updated that information if needed, when you opened this screen, the general information screen, for the first time, all of that updated information will automatically pre-fill. However, if you didn't, or if you notice you missed something, you can always go in and edit directly to the screen. You don't have to panic. You can always go in and add more information to the screen. You can do the update from here. A couple other items I did want to point out was if you want to print the screen or the table, you can once you've saved. Also, individual instructions for each table are located here at the top. And if I open it up, you'll notice it opened in a second screen, and here is the information needed for this screen, for this table. Once you're done, all you have to do is click on close and it'll bring you right back to the screen. The next button you'll see is Footnotes. If I click on Footnotes, I can go in and add text and simply click on the Save button. And when I do so, when I come down to the bottom of this table, you will notice my footnotes. The final item is something new that we have added based on the request from the users. They wanted an easier way to mark that a form was complete. So you can come up here once you've completed all this information. I'm going to click on Save. And it tells me that it was saved successfully. Once I've done that, I can simply come here and I'm going to mark form as complete. So now the form is marked as complete. And if you need to make changes, you can come back and click on it again. It'll bring it back to in progress and you can make any of those edits. One thing I want to point out is you can make edits to any of the tables up until the time that the report is submitted to SAMHSA. Once it's submitted to SAMHSA, you can't make any edits unless you contact your project officer and ask them to send you a revision request. And we'll go into that in more detail later. But for now, just to let you know, if this is a way you can track what forms are completed and what forms aren't. And you'll note up here, it now says that the 16% of this section of Section A has been completed and 3% of the application itself has been completed. So you can, like I said, you can go to the overview and you'll get the listing of all of the reports. You can also do it by section. If I click on Section A, PAMI Program Information, it will take me to a listing just for this section of the tables. It's the same tables, just a different way to navigate. You'll also notice now for general information, I have marked the form as complete. And once again, we're going to go into detail later on of what this means, what this is, what this indicates. Also wanted to point out that you can print the individual forms, as we said, from the table, but you can also come to the menu tree for each section and click and print the forms that way in a hard copy. So as you're beginning to see, there's multiple ways to navigate in WebBGAS. There isn't a right way or wrong way. If you've been doing this for a while and you have a way that you're comfortable with, that's fine. I just want to point out that there are new items here that may make the job a little easier. All right. Board, council, staff demographics. The only item that has actually been added is under the sex category. We have added unknown would not disclose. Now, one thing I will inform you is that this table will be blank. This table will be blank. You will have to enter the data. The other thing I want to point out, and it's the same way for most of the tables we're going to review today, all the fields are required and must have at least a 0. You'll see here I went through and put in all 5s. If I take out this 5, and then click on Save, I'm going to get this message. This is telling you that one of the fields is blank. I'm going to come back in, enter the 5 again, and click on Save. Not okay. That is something we will have to look into. I apologize for that. That's something we'll have the developers look into. Once again, please remember we are working in our test site, and this is where we want things like that to come up. We have not had an issue with that in production. Just wanted to point that out. But you'll also see that the number was saved. Okay, moving on. Governing board information. There were no changes to this table. There were no changes to this table. Once again, all of the fields are required and they will be empty. For executive director, once again, there were no changes. The fields will be empty. You will have to complete it. There is one thing I did want to point out. For these items here at the top, we have what we call a date picker. So if you click on the field, the calendar will automatically appear. Now, to select the year, you will notice that it is grouped in groups of 20. So if I need to go back, I'm going to click on the 2010, the one at the top. Now, if I click on the date, if I click on the year again, you'll notice now that the top year is 2000. So if I click on it one more time and do the drop down, it brings us back. So if you need to go back to get a year, that's how it's done. So then if I go ahead and click the year, and then I can use these arrows here to go either forwards or backwards through the months, and then select a date, it will automatically pre-fill. But so I wanted to point out that is how you can select for a year. We have had some calls where people thought that the year was only for 2020, that 20-year range. It is not. You can go back and forward by just clicking on the top year, like I said, and then doing the drop down and selecting a year. Number of mental health professionals on the advisory council. This is a new table. This is a new report that has been added. And I wanted to point that out. This is a new table that has been added for 2020. Once again, the fields will be blank and they are required. So you must enter at least a 0. For the PAMI Advisory Council and assigned staff, there have been no changes to this table. It is the same as it has been in the past. The fields will be blank, and you must enter information into each field before you can save the table. Moving on to the next section, demographics. There have been some changes to this table. The first thing I do want to point out is the year ranges, the date, the year ranges, age ranges, I apologize, have been updated. The age ranges have been updated. We have also down here for Hispanic, at one time in the past it was not Hispanic Latino, it is now non-Hispanic Latino. And also to point out that the races have been reorganized. The races have been reorganized. We all added race unknown. So it has been updated and reorganized. Once again, the table will be blank and will need to be completed. For PAMI eligible individuals served with PAMI program funds, this is one of the tables where the verbiage for the questions for the requesting information has been changed. So read through them carefully. Please read through them carefully. And as you can see, the table will be blank. And same goes for living arrangements of PAMI eligible individuals at intake. The requesting data has been updated. Some of them have been combined, some of the information has been removed, other items have been added. So once again, if you've done the report in the past, please read through it carefully because items have been changed. And once again, the fields will be blank. Before we move on, Crystal, do we have any questions?
Yes, we do have one question. The question is, do we only put the mental health professionals who are categorized as such? Or for example, if a family member is also a social worker, do we count them?
Lisa, can you have a response for that question?
Actually, I was trying to understand it. Can you read it again, Krista?
Yes. So the question is, do we only put the mental health professionals who are categorized as such? Or, for example, if a family member is also a social worker, do we count them?
Okay, can we go back to that field?
There you go.
Okay, here. All right. So this is for the advisory council members. So if any of the advisory council members fall within these categories, you can count them. Hopefully that answered the question.
All right. Any other questions?
That was the only one.
Okay.
Thank you.
All right. Now, for complaints, problems of PAMI individuals, this section. You are going to notice, if you have already opened the report, that there have been some changes made. The first big one is that we have some new columns. We have new outcomes that have been added. The category key is here for your assistance. You can locate it anywhere you wish which is more comfortable for you. But you'll also notice here that we have added the new categories. This field once again will be blank, and you will have to enter the information in each field, at least a 0. If we scroll down to the bottom, you'll notice the new categories have also been added here. There are 5 new categories. The other thing I wanted to point out for this table is you must enter at least one case before you can save the table. And you can enter at least up to 5 cases. So you must at least enter one. And if you wish to enter more, you can simply by coming down and clicking on an add new case. And in doing so, another field will appear and you can add that case. So you must add at least one, and you can enter up to 5. Also wanted to point out that the requesting information fields have also changed and been updated. So once again, read through them carefully as you're responding. The same goes for areas of alleged neglect. Here, we have 5 new cases. Once again, the requesting information has been updated. As you fill, just to let you know, as you fill in the fields up here, they will automatically be counted and collected. So you don't have to enter them here. Once you've entered the information here, it will appear under the totals. And you will see once again, you need to at least enter one case. And you can add multiple. As you can probably guess, areas of alleged rights violations. The same thing has happened. Now, also want to point out for the outcome category key, if you simply put your mouse prompt in the blue box and click, you can move it. You can move it wherever you need to. You can see all of the fields are blank. The new columns of outcomes have been added. The questions, the requesting data information questions have been updated and changed. And the new fields have been added. The new requesting outcomes have been added. And once again, at least one case must be added. Reason for closing individual advocacy cases. The only change here has been there have been changes to the requesting verbiage, updated requests of data. The fields will be blank, and you must add at least one case. Now, intervention strategies. If you have worked with Pami with the PPR in the past, this screen basically looked like the rights violations, alleged abuse violation screens. But because of the addition of the new columns, to make this go lengthwise, you would have been scrolling forever. So what we've done is we've restructured it. The fields will be blank, you'll notice that we have for abuse, we have A through I. For neglect, we have A through J. And then for rights violations, it's A through I again. You'll note that the statements are the same for all three categories. So the entering of the data is basically the same. Instead of scrolling all the way across the screen, you'll be coming down for each of these sections. And once again, you'll have to enter a case for an intervention. And once again, the category key has all of the categories listed. For death investigations, the information here under section 1 has not changed. Under section 2, they have added new requesting information verbiage. Before, I believe it was just A, B, and C. We now have D, E, and F. And once again, please, you're going to have to enter at least one case before the screen can be saved. All right. Number of interventions on behalf of groups of PAMI eligible individuals or individuals impacted. This was up until this year. This was title was interventions on behalf of groups of PAMI eligible individuals. So there has been an update to the title. Also, there have been no changes in what to count. The verbiage here in the requesting data information is the same. Under the types of interventions, the categories have been updated and the verbiage has been changed. The requesting information has been changed. So please read through this carefully. And once again, you must add a case before the screen can be saved. And finally, for this section, end outcomes. This is a new table. End outcomes of Pna activities. This is a new table that has been added for 2020. Please notice that the number are from closed cases only. The fields will be blank and you will need to enter the data. This is a new table. Any questions, Crystal?
Yes, Mayor, we actually have quite a few questions. I believe some of them are stemming back from the advisory council number.
Okay.
And going off of that first question is, they were categorized as such if they're a family member and also a social worker. There was a question that says, what if they are more than one? And I'm guessing that they're asking.
So if someone, so the question is, if there's someone on the advisory council and they fit into more than one of those categories, is that the question? Can they report it?
I believe that's the question. It just says, what if they are more than one?
Yes, they can report it. So that particular field of question is for the advisory council, and if they fit into any of those mental health professionals.
So they can report it more than once?
Yes, they can put whatever category that they fit in.
Okay. And then
I think it may be getting confused with the composition of the membership versus the mental health professionals that fit in those categories. So the thing is, if we're not giving clarification on your questions today, please understand that we will get these questions and provide a written response so that you can have the correct answer. So we don't want to confuse anyone, but we will address these questions at a later time as well in writing. What was the next question, Crystal?
there was a question, does the bottom table automatically populate? And then they followed up and answered. She just answered my question. Thanks. But in case anyone else had that same question, the bottom of the table does automatically populate.
Yes.
And this is still, okay, make a reference.
If we're talking about for areas of alleged abuse, neglect, and rights violations, that is correct. When you fill in the text fields, the numerical fields at the top, the data is automatically counted and pre-fills for the totals here at the bottom. So you don't have to go in and enter the data here. It does the count. It does, WebBGAS does a count and automatically fills in the numbers here. That is correct.
Okay. And then there's another question. For ethnicity/race, is everyone supposed to be reported in each category, that is, in an ethnicity and a race? Again, if Hispanic is ethnicity, should we also expect to try and identify a race? Can total of ethnicity and race differ?
The total should be the same. We are noticing from previous data that it's not, but it should be equal the same because there's the unknown. For those that do not fit in those first two categories, it should be put in, the remaining number should be put in unknown.
So if they're identifying as Hispanic, they'll also be identifying as a race?
Well,
is that the question?
That's what it says. Yes, is everyone supposed to be reported in each category? Yep, for so should they report it in ethnicity and a race?
Yes. Because we also have the category non-Hispanic Latino. So the answer is yes, they should equal.
Okay. And the next question is, I think the question is answered. Often PAC members fall into multiple categories. So they may be a MH professional, but categorized as a person with a MH diagnosis or a family member, etc. Wanted to know if you want all MH professionals listed by type, regardless of their membership category.
Okay, so if you have an individual in the advisory council and they fit into one of these professional categories, I'm just trying to make sure I understand the question clearly. Can they be counted more than once? That was yes. And then the second part of that was, Crystal?
Wanted to know if you want all MH professionals listed by type, regardless of their membership category.
Yes. And this is something that we add because this was a request from the work group, which includes staff from the PNAs.
Okay. The next question is, in the outcomes, number 5 reads medication. Is that a type 4 mediation? Sorry.
Going to N outcomes, go back to N outcomes. Okay, which one was about the medication?
It was. Yeah,
I don't see that.
In the outcomes, number 5 reads medication. So is it, maybe it's not this table, it would be the one that had the medication.
Under complaints. Okay. It's not this table.
If the person who asked the question, if they could clarify which table it was on, and we'll come back to it, I would appreciate it.
Okay, thank you.
So if the person who asked the question could please verify which table it was on, we're going to move forward and then we'll come back to this question.
Okay.
Okay.
The next question. In ACR, professionals, can we count them more than once? Example, social worker, but also CPS peer supporter.
Yes. So this looked like this question has been answered, asked multiple times. Yes.
Okay. Next question. The new N outcomes was not being gathered. Does this total have to match closed cases totals anywhere else in the report?
Now go back to N outcome again, Mary.
Yes.
It says number from closed case only. So they asking, does it have to support a number somewhere else?
Yes.
It should tie into all of their closed cases that they're reporting on the various categories: abuse, neglect, and right violations. Based on these 10 categories.
All right. Any other questions, Crystal?
This is a new field. It was not being collected.
That is correct. This is a brand new field for 2020. So this data has not been collected in the past.
Okay. And with that being said, we understand, and we did share that with you in the PPR letter that we sent out, that we understand that some of this data was not captured. If so, please just indicate in a footnote here. There's an area for the footnote that if you do not have anything in this area as to the reason why, that will be your justification. Thank you.
Okay, I appreciate you want closed cases, but we will have to put a lot of work into open cases like class actions, other interventions. We'll be okay giving it to you. For the group activities, where it asks for the estimated number impacted, is there a percentage of the population we should be using in projects that are more broad-based, such as statewide project, a citywide project, and such? For example, ACL has us use 1.58% of the population for developmental disabilities. Thus, is there a percentage we should be using for significant mental illness? Some guidance here would be much appreciated.
That's something that we will provide guidance with when we provide the written response.
Okay.
Any more questions, Crystal?
And that is the last one for right now.
Okay. All right. Thank you.
Thank you.
All right. Going to move on. For non-client directed activities, you'll see there's only one table in this section. The only change to this table was the addition of number D, or letter D, provide the number of PAMI program TA services. That has been the only change to this table. Grievance procedures. Once again, only one table in this section. For the grievance procedures, there were no changes to this table. One thing, couple of items I did want to point out. If this is the first time you're using the WebBGAS system, if you need to upload a form, you click on Choose File, select the application or the document you want to upload, and you'll see that it appears here, and then to simply click on the Upload button, and the form will be uploaded. Now, if you find this is the incorrect form, you can simply come over here and click on the X, and that will remove it, and you can upload the correct form. But that's how you upload documents within the WebBGAS system. Other thing I did want to point out for this form was, you'll see that you can add multiples of you can add other persons to this form, and all you simply have to do is click on the add person and it will appear. But there were no changes to the verbiage on this form. All right. Coming down, public comments. There were no changes to public comments. There were no changes of the verbiage within public comments. Impediments. There have been no changes to the requested information for impediments. You have external and internal. And the same for accomplishments, recommendations, and training needs. There were no changes to the verbiage for any of these items. Now, the PAMI budget. The budget will be ported from the 2020 PAMI application. The data will be ported from the 2020 application. There have been no major changes or verbiage updates to the 2020 PPR budget screen. The one thing that I do want to point out, and this is important, is that for Section 1, you must be a state supervisor to be able to enter data and see Section 1 only of the table. If you're a state user, you'll be able to view and edit and update the rest of the table. But if you are to enter information for Section 1, personnel, name, title, and you'll see here it says active for PAMI supervisor only. You must have a state supervisor permission to do so. If you don't, once again, please contact your SAMHSA PAMI project officer so they can inform the help desk to give you the state supervisor permission. That's the one important thing I did want to point out. There have been no changes, no additions, anything to the 2020 PAMI report budget. the other PAMI expenditures and revenues. There have been just a couple, there's just been one minor change here, and you will note here under income source and other resources, PAMI program only, we've added a subtotal. We have added a number 5, which is subtotal. So what will happen is as you enter here, you'll see we have a total for PAMI expenditures. And as I come down here, we now have a subtotal, which is the total for income sources, and then the entire program, the total of the entire. So before, these two sections were separate. Now we have the total for both sections appearing here at the bottom. So I just wanted to point that out. That's the only change that was made to this screen. If you haven't done so, if you in the past, or if you need to, it says here PAMI program carryover grant funds. Now it says identified by fiscal year. If you need to, you can add a new fiscal year by clicking on this box. And you will see you can enter the year and the data that's required. And also, if it was done in error, you can delete it. It will ask you, are you sure you want to delete? And you'll click on OK. All right. The other is for number 4, other funding sources. Identify each source. You come over and you add the source name. If you click on that box, once again, a field will appear where you add the source name and then the total or the amount that needs to come into the numerical text field. All right. Now, for the PAMI program statement of priorities and objectives, once again, the information will be ported from the 2020 application. The information will be ported from the 2020 application. We do have a new item that has been added for this year. Excuse me. When you open, you'll see now we have a button that says Add Strategies. And this is going to be for each objective. You simply click on the Add Strategies. The objective itself, the statement will appear, and you're going to select the strategies that were used to meet that objective. Once you click, you simply click on Save. And when it closes, you'll note that the strategies appear. The add outcome is also still remains. So if you're going to add an outcome, you simply click on Add Outcome and complete. Expected outcome was 3. Was it met? You're going to enter the number that were of the actual outcome. So was it achieved or not achieved? And then there are text fields asking if it wasn't achieved, why wasn't it achieved? Results and other quantitative narratives if necessary. And you can add other narratives if needed. Once you've completed this field, you're going to click on Save. And you will see that the information, whether it was achieved and the actual outcomes, will appear on the main screen. But the important thing to know is please notice that you now have to add add strategies for each of the objectives. Finally, within the report itself, the Advisory Council report. The only change you'll notice for this year is in the past, we had a area where you could review previous ACRs. That's been removed. The other thing I did want to point out was that there is a link. If you click on this for the Advisory Council report, it will open up the Advisory Council report, the most recent version, that you can then save to your desktop. So you have within WebBGAS, you have two ways of getting the recent version of the ACR. That was, as I pointed out at the very beginning, under related documents, or when you get to the Advisory Council table, you can also download it here. All right, before we move on, any questions, Crystal?
Hey, Mary, Crystal had to run to another meeting, so I'm going to be taking over the questions.
Well, thank you, Charlene.
No problem. The first question we have is, will the grievance policy automatically repopulate every year? It doesn't change annually.
How it has been in the past is once we have the initial information for 2020, this is the initial information. Many of the fields moving forward, we will pre-fill them from the previous year. That has been the standard procedure for 2017 through 2019. That for many of the tables, we will automatically pre-fill from the previous year. So starting with 2021, many of the tables will already have the data there, and all you'll have to do is go in and update and edit that information.
All right, so the next one is, I think, piggybacking off of the previous conversation. It says, yes, just checked complaints, section C, intervention number 5 under each abuse, neglect, and rights reads medication. I believe it should read mediation. Medication is obviously not a type of intervention. See between number 4 litigation and number 6 negotiation.
So we're okay, hold on.
Go back to the top, Mary. Bring it.
Involuntary medication.
Number That's correct.
That is, no, it should be involuntary medication.
That's correct.
The client is being forced to take medications. Once again, as Lisa said earlier, we will sit down with these class questions and clarify and respond.
Oh, I received another response on that one. It says you have to look at the intervention section. You're still in the wrong section, not the outcomes, the interventions.
Oh, intervention, okay.
All right.
Mary, go back to the overview and then we can drop down
Okay.
to it. Okay, intervention strategies.
Okay.
Oh, that number 5 should have been mediation, not medication. That's correct. That needs to be changed.
Excellent catch. Writing notes now.
It should be mediation.
Okay, so we have that.
Thank you to the person who caught that for us.
Yes, thank you. Thank you. All right.
I have a couple more, I believe, Mary.
Okay.
But one of the, I think it's, it says it would be extremely helpful if the PPR would be made available in a Word download like the ACR for drafting purposes.
We can put that down. I also have, you can print out the entire document. You can print it out, as I said, you can print it out form by form. If we come to the section table, you can print out each one and you'll have a hard copy. And remember, as I said before, if we go to existing, when you come here, you can also print it out as a hard copy. Now it does, I believe, print out as a PDF. But if you wish, if you have the ability, you can, if you have a PDF, you can write within your PDF, you can do that, or you can change it, alter it to a Word document and do that also. But you're still going to have to then enter the data into the WebBGAS system. But if you want a hard copy that you can print out and complete and then go back and enter that information, I understand. But you can print it out, like I said, either by coming to the existing application screen, or you can go in and do each table itself. If you're looking for a standalone that you can print out before you even come in, that's something that we'll have to discuss with SAMHSA and see if there's something we can do. I will write that request down though, and we can discuss it further. Any other questions?
I think that's all we have for now.
Okay. All right. You guys have great questions. Thank you for your patience. Really appreciate it. And your input. It is very much appreciated. So moving on. Now, you've entered all of your information. You think you've got everything, you believe you have everything done. Now you're ready to submit. You're going to submit the application to SAMHSA. As I said earlier, once you complete a table, you can go in and mark it as complete. And that way track what has been done, what hasn't been completed. Or you can, once you've completed the entire application, the report, you simply go to each section and you see here where it says change status. If you click on complete, it'll show it as completed, and you can just go through each section and mark them as complete. And it'll show you here at the top that the section is now 100%, and you've got 30% of the entire application. So we're just going to come through and mark these all as complete. This takes a moment. Now, you will note, I want you to keep an eye on the menu tree over here. I am now going to click on Advisory Council. That's the final one that we have. And you'll now notice that the application progress is 100%. And you will see here that the Pna Supervisory Review button appeared. So now we're ready. We'll say you're the state user and you're ready for the state supervisor to review this information. If you have both roles, you're still going to see this button appear. So the Pna supervisor goes in and does their review. And if there are any edits they feel, they will notify the state user that they need to update this information. Once they believe everything is correct, the Pna supervisor review, they've reviewed it and now they're ready to submit it to SAMHSA. It is now ready to be submitted to SAMHSA. And as I've said before, up until this point, you can go in and make any edits, make any changes that you need to. Once we submit it to SAMHSA, it's locked. So now I'm going to submit to SAMHSA. All right. And it says here the application was submitted successfully. So now if I need to make any changes, the tables are locked. It's not going to let me. All right. Now, the next step in this process is the revision request. And that's what I want to go over now. And I've already set up the process. You have submitted your report to SAMHSA. The project officer is now going to sit down and they're going to review. And if they have any changes, they're going to do what we call a revision request. There are two ways you can navigate for revision requests. Once a request is made by your project officer, an email will be sent and it'll tell you where that information needs to be updated. So you have two options. You can go directly to the table itself, or, and I'll point that out again, or you can come down to the revision request tab, click on that. You can expand all forms and you can also print out your revision request if needed. I find the easiest way to navigate is to do the drop down and select one. And you can do without revisions, forms with revisions, ones that have been sent to state, in progress, all of the different statuses of where the forms are. The one I find easiest to work with are forms with revision. So if I click on forms with revision, it's going to open only the tabs that have only the tables that have revisions in process. Only the tables that have revisions in process. And so you can, to view them from the Revision Request tab. You come up and you click on the View Form. And the revisions appears at the top of the form. And you'll see here the status is Start Revision. All right, it was sent to state, the status says sent to state, and it says Start Revision. You'll notice that if I go in, all of these fields have been grayed out. I can't do anything. When I click on Start Revision, I'll now be able to go in and make selections. You'll see that they're now, all the fields are active. I can now go in and make any edits I need to and update the information. The description will tell me what needs to be done. It says here, footnote needs to be added. And it also tells you the status is open for revision. This opened in a second tab at the top of the screen. I just want to point that out. This opened in a second tab at the top of the screen. And I can say this because I've done this myself, is if you don't remember that and you keep coming and you come down to revision request, you'll come up here and you'll notice you have 30 tabs open. So please simply remember that once you can do everything from the screen. I can go in and I can make whatever changes need to be made. And then I can sit here and click on, once I've done it from here, I can click on complete revision here, or whatever way you want to do it, you can come back and click on complete revision here. So I just wanted to show you there are different ways to navigate. The other thing I wanted to point out was, you'll notice the different status. This says completed. That means that you updated the information as requested and have sent it back to SAMHSA. Now, the project officer is going to go in and review the updated and make sure it is correct. If it is correct, they will then approve that revision request and the status will change to approved. If they found something that was not corrected or not updated, they'll disapprove the request and you will once again receive the information in an email what needs to be updated. So the status as completed simply means that you, the user, the Pna, have completed that. It has not been approved yet by the project officer. Once they do approve it, the status will change. And you can just tell by quickly going through here the status of different, in the different processes for the different revision requests. This one says it's been open for revision, it's waiting. This one says it's been sent to state, so it has not yet been opened. So I just wanted to walk you through that process. All right, Charlene, any questions?
No questions, Mary.
Okay. Well, I want to thank you all. Thank you all for attending. Your input has been great. I really appreciate it. As Lisa and I have stated before, we will go through and we've collected all the questions and we will answer them. And then we will send out the questions and the responses to all of you who have attended. The other thing I do want to point out is if you do have any questions regarding how to enter data into WebBGAS, how to navigate within WebBGAS, please contact our help desk staff. They are very good at answering those responses. If you have any programmatic questions, please contact your SAMHSA PAMI project officer. Once again, I want to thank you for your attendance. I hope you have a very safe day. Take care. Bye-bye.
Bye-bye.